Imagine having a car and you have never taken that car for servicing. Sooner or later, problems would likely pop up. Same applies to our body. Regular reproductive health checkup actually helps us stay healthy, catch illnesses or diseases on time, and prevent future bigger problems, future health problems, future complications. But a lot of us actually skip this reproductive checkup because we are either shy to talk about it or we see no reasons why we should talk about our reproductive health. Because we see no reasons why we should talk about it and because we are shy, we don't really create time for it. But let me tell you, reproductive health checkup is just as important as your overall health and well-being. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as a nurse with a difference. And on this video, I'm going to be sharing with you 6 reasons why you should do a regular reproductive health checkup. The first one I have to share with you is early detection of diseases. Remember, the earlier, the better. Most reproductive health issues, such as hormonal imbalance, sexually transmitted infection, which is STI, prostate issues, and also cervical cancer, may not show symptoms at the early stage. They may not show what? They may not show symptoms at the early stage. But if you usually have a routine, regular checkup for your reproductive health, definitely they are going to detect it on time and start treatment on time. The second one I have to share with you is prevention of STI and other infection, and it also helps to prevent complication. If you as an individual, you are sexually active, it is very important for you to create a routine checkup for STIs such as chlamydia, gonorrhea, syphilis, and HIV. Because when these diseases I just listed are treated on time, it prevents further future complications such as infertility, such as chronic pain, and it also helps you to prevent transferring it to your partner or reinfecting each other. So you can see why it is very vital for you to go for your normal reproductive health checkup. The third reason I have to share with you in regards to routine reproductive health checkup is it helps you to monitor your menstrual and reproductive health. Irregular period, missed period, painful cramps, heavy bleeding might be a sign of PCOS, which is polycystic ovary syndrome, might also be a sign of endometriosis and thyroid issues. So when you do your normal routine checkup, it helps to detect these on time and prevent future infertility. I've seen ladies sending me messages and saying, Nurse Mercy Mary, for the past 3 months, for the past 4 months, I have not seen my period. The next thing I usually ask them is, what have you done about it? Have you paid a visit to your doctor? Did they do any scan? What did the doctor tell you? And most of them will tell you, I have not done anything about it. So if you are a lady and for the past 2 months you've not seen your period, you don't need me to remind you that you need a reproductive health checkup. The fourth reason for that routine reproductive health checkup I have to share with you is fertility awareness and family planning. If you are a man or a woman and you're trying to conceive, you're trying to get pregnant, or you are even trying to avoid pregnancy, this regular checkup with your doctor, it's going to help you when it comes to preventive pregnancy. It's going to help the doctor gives you clue on the best family planning method that will be suitable for you at that particular moment. And if you are trying to conceive, the doctors are going to carry some series of tests in you to know your fertility state, and are going to be able to personalize your care, your treatment when it comes to having kids. Generally, when people have been trying to conceive, they say, oh, let me just wait 2 years and see how it goes, without even visiting the doctor to actually know if there's a problem that needs early treatment. But with your routine or regular reproductive health checkup, they are able to know your fertility status, and they're able to know, okay, what best family planning do they think will be best for you. So if you are trying to conceive, try visiting your doctor to know what's next to do. The fifth one I have to share with you is cervical or prostate cancer screening. But first of all, let's talk about the women. For the women, a pap smear test or a HPV test is recommended because these tests actually help to detect the signs of cervical cancer on time. So this particular test is recommended every 3 to 5 years, depending on your age and also medical condition. Now, let's talk about the men. For the men, a prostate exam is crucial because it helps to determine early signs of prostate enlargement and also prostate cancer. So it is recommended for men above 40 years of age. So if you are a man above 40 years and you've not done a prostate exam before, I will advise you do so. And if you are a woman and you've not done a pap smear test, I will advise you do so. That reminds me, I actually have to book my pap smear test. So after this video, I'm going to be booking my next appointment. The sixth one I have to share with you is it helps to address your sexual health concerns. Yes, it helps to address it. What do I mean by that? A lot of people out there are battling with erectile dysfunction, low libido, painful sex. They are battling with all this, even vaginal dryness, but they are skeptical. They are scared to talk about it. But if you have a regular checkup with your doctor, it gives you an opportunity to discuss these concerns with your doctor. Sometimes this vaginal dryness, erectile dysfunction, low libido might be a sign of some underlying health condition, might be a sign of hormonal imbalance that needs to be addressed. So that regular checkup is going to help you address those concerns and going to help your mind be at rest. Now that takes me to the last and final point I want to share with you. Because your health concern is addressed, it's going to cause this peace of mind. Like, oh, you know what is happening. You're treating it. So you're going to have this rest, like peace of mind. You're going to you're going to be resting. I don't know the right words to describe it, but when you know about your health conditions, when you're able to address your health conditions, there's this feeling you usually have. You feel more excited because you know what is happening, and if it needs treatment, you are able to provide adequate treatment for it, and the doctor is going to help you out with it. So it is very important for you to go for your regular checkup. And just an additional point I made. So when you go for your regular checkup, such as your postnatal checkup for pregnant women that just put to bed, it helps to deal with mental stress associated with pregnancy. It helps to monitor your overall well-being after pregnancy. So you can see regular health checkup, regular reproductive health checkup to be specific, has a long way to go when it comes to your overall health and well-being. In conclusion, I just want to let you know that reproductive health is very crucial. It's very important for your overall health and well-being. When you do this reproductive health checkup, you pay a visit to your doctor in regards to your reproductive health, it actually empowers you. It empowers you to actually know what is happening in your body because you're having a conversation with your doctor about yourself. You are not searching it online. The care is being personalized. You are doing a one-to-one conversation with your doctor, not what you see online. So if you've not booked your general checkup today, if you've not booked your general reproductive health checkup today, to be specific, I would advise you to do so because that is going to go a long way to help you. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.